Welcome to Doctor's Nutrition. I'm Dr. Jim.
And I'm Dr. Janine.
We're going to be talking about something that affects way too many people today. That's anxiety.
Yeah, have you ever felt like totally overwhelmed? I mean, that's what a lot of people tell us
Daily.
every single day, is that they are so overwhelmed. And so you're not the only one out there that feels overwhelmed.
Yeah, we've seen such an increase. Now, we've been doing this for a little over 30 years. And in that 30 years, granted, a long time ago, people would come in and they felt, a little anxious, a little overwhelmed occasionally. You'd hear somebody talk about it. Now, it's daily. Everybody that comes in, oh my God,
Yeah, but we wanted to let you know today there is help. There are things you can do, and we're going to talk about how to identify the problem that might be causing it and what to do for different problems for anxiety. The first step we say is do some lab work to see what may be the cause.
One of the biggies that we see, and we check it on virtually every panel we do, and that is cortisol. There's your stress hormone right there. And some of these cortisol levels come back off the charts. It's amazing.
It is. And it is really, and it's getting worse. And we're seeing it at all ages, and we're seeing it a lot in teenagers. We're seeing it a lot in older people. So there is, and it doesn't really make a difference. It used to be everybody think the females were the ones that had all the anxiety, but we're seeing just as many boys, especially teenage boys, come back with extreme cortisol. And so they're just as stressed as everybody else.
And the men, we get a lot of men that come in when we do their lab work, we do their cortisol as well. And we see so many men, and granted, it may be job related or business related or whatever, but they are just stressed. And you ask them, do you feel stressed? Oh my God, I'm to the max.
Right.
And we hear that every day. We really do.
And with anxiety, it can increase your blood pressure. It can cause other issues. It can increase heart issues. So it isn't just that it doesn't affect you, because it does. And so, we always like to check the cortisol. We like to check the thyroid. Thyroid problems, both high and low, can actually make anxiety. Different nutrient deficiencies can definitely affect it as well. So whether it'll be B12 or whether it's vitamin D or whether it's magnesium, because magnesium is a huge thing people are deficient in, and it does make a difference in anxiety.
And then we have the famous MTHFR. People have read so much about this. It's about the methylation process. And, genetically speaking, I first got interested in genetics probably 20 years ago or so. And at that time, they thought maybe 15% of the population had at least one of the mutations that affected them somehow. Well, fast forward 20 or so years, now we look at it and we say there's a vast majority of the people have at least one, maybe two. And the more of those genetic mutations that you get involved in that methylation process, the more anxiety, the harder it is to control. The depression and everything else leads with it too. So it's quite common now. It really is.
Right. And all the things that we just talked about, except for the MTHFR mutation, but that can actually be checked separately or on a lot of our panels. So if you have any questions on what panel might be right for you, just give us a call. Now, another area that we like to check, if somebody's anxiety, we still don't find the cause on regular lab work, there is a neurotransmitter test that's really good. What it looks for is your neurotransmitters, your dopamine, your serotonin, your norepinephrine, your epinephrine, and all the amino acids that actually are precursors to those brain chemicals. So, and a lot of them are for calming. So we like to do that if we can't find the answer in the other lab work. So there's a lot of things that can be done. We want you to know out there that there is hope, and then there is a way of helping. And unfortunately, in medicine today, you go in with anxiety, they give you antidepressant, they give you anti-anxiety drugs, and they don't look for the cause. It's not very successful when you treat it that way. Not at all. You want to look for the cause, and you got to get rid of the cause.
That's true. So many times today we see people come in and they're on an antidepressant or something. It's just automatic. When you go into complaining of this, here, take this. And they take the drug, and maybe for a while it helps a little bit, but then they wind up with some of the side effects from those medications. Not so easy to live with sometimes.
No. And again, you're not getting to the root of the problem. So the problem is still there. If you have a B12 deficiency and that is making you anxious and depressed, and you take an antidepressant, it may help some, but do you still have a B12 deficiency? Yes, you do. And if you have a B12 deficiency, it can actually cause, optic nerve damage, other nerve damage. It can start causing some severe problems down the road. So that's another reason, not just for symptoms, it's important to prevent other health problems down the road. Now, we're going to tell you a few things that we use for anxiety. Now, it really We personally base it on your lab work, but we're going to tell you some of the things that we commonly use, just
Right.
that, just so you know kind of what works and don't work.
One of the big ones is L-theanine. It's an amino acid, and it helps calm the brain activity. If you look, it calms all the brain waves down, so to speak, the brain activity, except the alpha wave, and that's the one where you can communicate with each other, etc., and stay fairly alert. I wish I'd have had it when I was in school.
Yeah, the good thing about theanine, too, is it doesn't drug you. It does not calm you.
Not at all.
It does not make you feel like you've taken something to bring you down.
No.
It actually makes you focused. So focused and calm is kind of what theanine does. And it is so safe. They've never found a toxic dose on it. So it is a very safe thing, and you can add it to any medications. A lot of the things that we use for anxiety can't be used with other medications, and we will tell you those as we get to them. But theanine can be taken with anything.
Right, it sure can.
It can.
Kava is another biggie, and kava is, I think in the Polynesian islands, they use it. They have a ritual where they kind of end their day with a drink of kava. And they make a tea out of it. It doesn't taste too good. I tried tasting it.
Kava
it really doesn't
well.
taste too good. But a capsule, totally different. Just swallow it and it goes on. And it really is a great calmative. You can take somebody that's just really having a bad anxiety attack almost and give them some kava, and you can calm them right down.
Right. It's not as strong as the medications, but it is your natural alternative to the anxiety drugs. It cannot be taken with the prescription anxiety drugs.
Correct.
So I do tell people, do not take them together. There's been some really bad effects because they accelerate each other. And when they accelerate each other, that's not a good thing because it makes both stronger. So you don't want to take kava if you're on anything prescription, but if you're not taking a prescription, take kava. The good thing about kava can be taken as needed. You don't have to take it every day for it to work. Same thing with theanine. Neither one of those have to be taken on a daily basis. And actually, you're better off with kava not taking it on a daily basis. The more kava you take long term, the more kava you need for it to work. So if you only take it when you need it, you can get to where the lower doses do still help you. Everybody out there has read on the internet, kava can be bad on the liver. Not what we've seen in 30 years of practicing. You do see it on the internet, and all the stuff that I have seen on kava affecting the liver has always been in extreme cases. Somebody takes a half a bottle of kava and a fifth of liquor. Well, yeah, it's going to be pretty bad on your liver at that point. In Fiji, you mentioned them doing it for years. They've done it for, I think they said, a huge amount of years.
Like thousands.
Yes, and they have not had that problem. But it's really about when people overdose it, taking it with other medications, taking it with other things that affect the liver. Yes, and in that case, a lot of things can affect the liver. So
no doubt. Just
cautious if you have a liver problem. You may not want to do kava if you already have a liver problem. I have not seen it cause liver problems at normal dosing.
Now, another really good neurocalmative, and it's one that our body makes, it's called GABA, or GABA, or gamma-aminobutyric acid. Great for calming, and our body uses it. Like I say, it's a neurotransmitter that our body actually makes. And sometimes we just don't make enough of it, depending on what's going on in the gut, because it's got a big relationship to the GI tract, the probiotics that are in that GI tract, and so on, being able to make those chemicals. And so it's one that we really can get some good results with.
And that neurotransmitter test I mentioned, it actually tests GABA. I mean, it'll tell you, do you have enough, do you not have enough? We use it a lot of times for sleep because it is good for sleep. It is good for lowering cortisol. When it comes to anxiety, we do really see a lot of people are high cortisol. We have a product called Cortisol Soothe that works really well if your anxiety is from high cortisol.
Right.
It works so good. And it is a combination of your Magnolia officinalis, your ashwagandha. It does have some theanine. It does have a little vitamin D. It does, so it's a combination, and the combination together works so good. And so if cortisol is the problem, Cortisol Soothe is really good. And a lot of people, I will put them on Cortisol Soothe in the morning and GABA at bedtime because then it'll help them sleep better at night as well.
Now, another good one, as long as you're not taking antidepressants, and we get an awful lot of folks in that case, they come in and they're complaining of maybe a mild depressive disorder. They're just kind of sad. The world's just not treating them right, that kind of thing. We understand that. And that's 5-HTP, or 5-hydroxytryptophan. It's actually the precursor to serotonin in our body.
Right. Another one of the things that's tested on that neurotransmitter test.
Right.
So a lot of the things that's used in natural medicine, you can actually test to see which ones are probably going to be better for you. It is not the cheapest test in the world. It's about $375 to do the test, and it is a urine test. So we can actually ship you the kit. You have the urine, you send it into the company, and we get a report.
I promise you, it's an eye-opener.
And it really, I have seen some really good results when we follow that, because if you think about it, in mental health, it's mostly guessing. It's mostly saying, okay, this is your symptoms, what might best help your brain. Well, when you do this test, it tells you. It tells you which areas. And sometimes I'm surprised when the test comes back and I'm like, this person does not have low serotonin. You would think by their symptoms they did, but you never know. And then a lot of people do have low serotonin. Some people have high dopamine. Some people have low dopamine. Some people have, most people out there, and I can say almost every test we've done, have low PEA. And that is one of those things that we see low in most people. So it's something that you can test. And one of the other things you can use for anxiety is taurine. That's also tested on that test as well, because it is an amino acid that has a lot of calming effect.
As well as tyrosine. Tyrosine's also...
Tyrosine's checked as well on that test, and tyrosine we also use. Tyrosine increases dopamine. It lowers cortisol. Works very well at 5-HTP.
It really does.
We have a lot of people that a 10-to-1 ratio of 5-HTP to tyrosine works really good for depression and anxiety.
Right.
So there's so many things that you can do. So don't think you're out there and there's nothing that helps, especially if the medications haven't worked for you. I have had many people over the years that have already tried every medication and with no results. And we figure out what's best for them, and they can't believe the difference on what they see.
It really does make a big difference.
Yep.
It really does.
One more that we hadn't mentioned was phosphatidylserine, which is also something that lowers cortisol, helps brain function, memory, great for the brain.
I was going to say it's great for the brain, regardless.
It is, regardless. It's just good for your brain. So phosphatidylserine is another one that we will use. There's so many different things, and like I said, if you do the testing, then you can figure out what is best for you, because everybody is a little different.
I think one of the big takeaways is that we don't want to let anxiety consume us. There's tests that can be done. There's treatments that can be done other than some medication that's going to cause a lot of side effects or something.
Yes.
And we see some really great results during the neurotransmitting testing. That's a good one. And
then just even our basic testing to see if you have one of the other underlying causes. Do you have high cortisol? What do you have that might be causing this problem?
Could be some medication you're taking.
It could be a medication. And one thing I see daily, I would honestly say probably daily, is birth control pills.
Yeah.
Birth control pills have a way they make your lab work look. I can tell it. People don't even list that they're on it, and I can tell they're on it because of the way the lab work looks. They actually can't utilize the thyroid correctly, and their cortisol goes high. And so you see people, the young girls on birth control, have so many symptoms and depression and anxiety, and they're all on antidepressants and anti-anxiety drugs. And when they come in, a lot of times I'll tell them, it's your birth control pills because of the way your lab work looks. And a lot of them come back months later and say, I can't believe, but you were right. I didn't want to get off of them, but oh my gosh, I feel so different off of them.
Yeah, something that a lot of times when I'm discussing with a female about birth control, and I tell them, what it's doing, think about how it has to work. It's making your body think you're in menopause, okay? So
it makes you stop ovulating.
It makes you stop ovulating. So you're in menopause.
Yeah,
basically.
Exactly.
So, because that way you can't get pregnant.
And ask any menopause woman what their number one side effect is for menopause. Right. It's usually anxiety.
Typically it's anxiety and possibly even depression to go along with it.
Exactly, because when those hormones fall, it's a huge difference in the body. So hormones is another thing that we look at when it comes to anxiety. So like I said, there's so many different things you can look at. So don't be overwhelmed. Don't think that there's nothing you can do. There is.
Yeah, there certainly is. And if you have any questions, like to talk to one of us about this a little bit more, feel free to call us. You can go to our website. There's a place on there to fill out a consult sheet and just specify that you'd like to talk to one of us. We'll be glad to call you back. We'll talk about it, and we'll offer some of these things to you. We can make you a little bit more aware of things that you can do. Find out a little bit more about your history, because your history is what counts. Look at that history, see what we can do to make it feel better, and maybe make the world a whole lot better to live in.
A little bit brighter.
Right.